Hello, everyone, and welcome to the Your Mark on the World show. I'm your host, Devin Thorpe. I'm a Forbes contributor covering social entrepreneurship and impact investing. And today we have a great academic and really an exciting conversation about impact. Our guest today is Quentin Palfrey, who is the executive director of JPAL North America. Quentin, thank you very much for joining us.
I'm thrilled to be here. Thanks so much for having me.
I think this is an important discussion about the way that social entrepreneurs and others who are interested in impact can measure the effectiveness of their interventions. There are so many people around the world trying to do things that solve problems, to make the world a better place. And this idea of trying to actually use a scientific approach to measure whether or not it's working is, I think, vitally important. So tell us a little bit about your thinking about the landscape that you operate in.
Sure. So as you say, in philanthropy and in government, we spend a lot of time and resources trying to figure out how to solve complex problems. And one of the most challenging things is to figure out whether what you're doing is working. And the traditional way that people think about that is you sort of look at what's happening before, and then you do your thing, and you look what's happening afterward. And you try to figure out whether what you're doing, is making a difference. The problem with that is that it can be really hard to know whether the change that you see is a result of the thing that you did or whether it would have happened anyway. And I'm reminded of this problem that medieval doctors used to have where, they'd apply these leeches, and we'd say, you apply the leech to a patient, the patient gets better. They'd say, great, the leeches worked. And if you apply the leech to the patient doesn't get better, they say, oh, it's too bad we couldn't get to the patient in time with the leeches. And the difficulty is that there's no counterfactual, right? There's no other patient. And so it's very hard to figure out whether what you're doing is having an impact. This is a problem that we've solved in medical science largely by use of the randomized control trial. And under similar circumstances in the medical profession, if we're trying to figure out whether treatment works, we actually can look very rigorously at the effect of the intervention by using a placebo and a treatment group. And what that allows you to do is, if you do it rigorously and with a significant enough sample size, is to actually have a clear sense of how what you're doing compares to what would have happened if you didn't do it. And this is an approach that's really transformed the hard sciences, right? So over the course of a century or more, we've developed a much better sense of what works. And sometimes you get a home run, but a lot of times you get singles and doubles. But cumulatively, over time, we build up a body of evidence. So what we do at JPAL, which is a network of economists at top research universities and some really dedicated staff, is we apply this really rigorous scientific approach to examine what works and why. And we do the same thing that you do with drugs, which is you take a solution to a problem. Let's say you want to vaccinate a bunch of kids because you want to avoid disease. But instead of just sort of guessing whether what you're doing works, as you roll out the program, you incorporate randomization into design of the program, and that allows us to be a lot more nuanced about what we learn.
Fantastic. Now, I think about this largely from the standpoint of social entrepreneurs. And so oftentimes the social entrepreneur has a limited budget. He's trying to change the world, or she is, and they're trying to really make a difference in the world, but with very limited resources. What kind of information, what kind of resources are available through JPAL for learning what's already known about your intervention?
Yeah, so we have we do spend a lot of time and energy trying to, so, these economists write up the findings of their research in academic journals, and that's very valuable within the academic community, but it can be difficult for policymakers, for philanthropists, for people sort of in the policy space to really sort of access that information in an actionable way. And so one of the things that we try to do with the research that comes out of our network is write them up in shorter summaries and develop various kinds of tools, both for training people how to be effective producers and consumers of evidence, and also to know what works. So I run the North America part of the JPAL network, and so we're focused on domestic challenges that affect poor people. And we've developed some really interesting learnings, and we're in the process of developing some really interesting findings about things like health and education and crime and housing and economic mobility. So we can work with government partners, we can work with philanthropic partners, and we can work with the public to sort of disseminate this information.
Well, it is important for people who are thinking about these things to access that. And what's the best way for them? Is there an archive? How do people find that? I realize you're trying to put it out there, but think of this in terms of someone who's trying to do research on their intervention.
Sure. So, I mean, there's a couple of different ways to do that. So certainly on our website, we have a very comprehensive, it's povertyactionlab.org, and you can access the research things under our evaluations tab. So that's sort of the easy sort of Google kind of way. But most of the time, it actually requires a little bit more engagement to really unpack that stuff. So we have an executive education course. It's also available online. We have an edX version of it, and you can look at the YouTube videos, but we do it in person. So we have a lot of rigorous training. We do work very closely with some state and local policymakers and other sort of nonprofit partners, really to sort of help them know what we know, and to help distinguish between good and bad evidence. So I think there's a range of resources, from the very simple things like writing up a nice 2-pager on what we know about opioid use disorder and the set of treatments that state and local governments are using for that, or what we know about housing vouchers and conditioning them on moving to higher opportunity neighborhoods, or what we know about expansion of Medicaid. So we develop these resources to help people sort of understand the learnings in various sort of policy relevant fields. But we also, we have these deep partnerships with state and local governments and with federal government agencies and other partners to really sort of help them to design programs that are in a way that allows them to generate evidence, and so that we can replicate best practices, so that there can be a community of learning.
Now, give us one real good example of one of your randomized controlled trials that's, the paper's been published and it's had a real impact on the way people think about solving a problem.
Sure. So I'll start with actually what I would call a natural experiment. Where we didn't design the experiment, but the conditions were right for really rigorous learning, which was during the time when the ACA Obamacare was being debated, the Affordable Care Act. The state of Oregon was expanding its Medicaid program, and a lot of times when government gives services to a poor community and they can't afford to provide them to everyone, they do it in an ad hoc way, or they do it in a way that is first come, first served, or those sorts of things. But what the state of Oregon did was very smart and very helpful, which was that it used a lottery to determine who got access to expanded Medicaid services. Now, at the time, there was a raging debate over, whether Medicaid should be expanded, and some of that was, philosophical, right? So people had different views on the proper role of government, whether an individual mandate and punishing people for not purchasing health insurance was fair. So some of the arguments were not susceptible of scientific evaluation, but some of them were actual, factual, ascertainable questions, like what would happen to emergency room utilization? What would happen to the financial condition of the people who got insured? What would happen to their mental health? What would happen to their physical health? And so when Oregon used the lottery system to expand Medicaid to part of the population, that looked very much like a randomized controlled trial in the sense that the people who got health insurance were statistically identical to the people who didn't. And that allowed scholars to take a look at what happened to the group that got it and also compare it to the people who didn't. And they came up with really interesting findings. They used all sorts of different approaches. So they were able to use existing administrative records, right? And that's a very useful tool for getting very nuanced information about people. But they also did some survey data. And what they found was, didn't fit into anybody's political frame and was very informative for the discussion. So they found very significant benefits in terms of the financial well-being of the people that were covered. Catastrophic losses were nearly eliminated for that population. Mental health was improved for some of those folks. But on the other hand, some people have thought, well, maybe emergency room utilization will actually go down because people will have access to primary care and we'll have these benefits of people not going to the emergency room, but instead going to the primary care doc. And in fact, we saw the opposite, or the scholars saw the opposite. What they saw was when people got access to health insurance, their utilization went up across the board. And so, sort of abstracting out from the specifics of that question, what it shows is that you can use science to replace the sort of hunch and anecdote sides of policy making and really start to sort of engage with facts, and that's a very helpful thing in policy making. A lot of what we do doesn't come from a sort of natural experiment like that. That's sort of a found experiment. A lot of times what we will do is we will work with a government at an earlier stage or another partner at an earlier stage when they're trying to deal with a problem. So we have a competition called the State and Local Innovation Competition, and we invite states and cities and counties to apply to get some technical assistance and some funding from us, and also ideally then we match them up with scholars who can study the problem. And when we did that last year, we noticed a trend, which was that the opioid use disorder crisis was really on a lot of state and local policymakers' minds. And so we decided not only to work with a couple jurisdictions on that, but we thought, people are the policymakers are kind of voting with their feet, and they're demonstrating this as an interest for them. And so we pulled some scholars together. We pulled some jurisdictions together, some doctors as well, and had a conversation about what we know. And that we were able to work with the Office of National Drug Control Policy, which was under the Obama administration, and help them pull together some of the best resources on what's known, because this is an area where people are really trying to figure it out. Hopefully, over time, some of these models will be successful, and we'll be able to communicate with some of the others. So maybe you ought to try more of this. So that's one way that we can work with jurisdictions.
Fantastic. Well, I really appreciate those insights. I want to just give you a couple of quick, somewhat personal questions. First, you become a role model in this space as a leader. Who do you look up to as a role model?
Well, I think that what's really interesting about this space is that there's really a little bit of movement for evidence-based policy making. So there certainly are some terrific scholars who've been really dedicated to this work, and Larry Katz at Harvard and Amy Finkelstein at MIT have been real sort of leaders in the space, and I certainly have looked up to them and their approach to this. Some of my former colleagues in the White House, I think, really empowered a lot of this movement. So Tom Khalil who was the deputy director of the Office of Science and Technology Policy, where I worked, was really instrumental in sort of helping to build momentum around these sets of issues, and then launching what was called the behavioral science, the social and behavioral sciences team that came out of the White House and was in the federal agencies. Also, there's some great work on the other side of the aisle as well. There are Republican governors, Republican mayors, the Speaker of the House have been, really dedicated to this evidence-based policy movement. So it is a really interesting and exciting place where bipartisanship is possible in a really hyper-partisan era. And so that's an exciting piece of this as well.
That's great. Now, you could be doing anything. You clearly are a super capable guy. Why is this important enough to you that you do it?
So thank you. I appreciate the compliment. I think that there are two really exciting things about this space. One is that the difference between doing things that work, particularly when you're talking about scarce resources around poverty, and doing things that don't work, is the difference between people living and dying. And so I really think that being smart about how we allocate scarce resources is one of the best ways to have an impact on real people's lives. The second is that I really think that the moment is ripe for people who are involved in government and people who are involved in philanthropy to be more sophisticated in the way that they use evidence. And I think that there's an opportunity to kind of create a movement for evidence-based policymaking. In the international philanthropic space, you've seen this movement beginning to grow, where there's sort of a little bit of a virtuous cycle between funders and the scholarly community and some nonprofits, where the funders are beginning to demand, good data from the people that they fund. The people that they fund are being more rigorous in the way that they roll out philanthropy, and the scholarly community is sort of helping to make that happen. And in a way, also, the journalistic community is beginning to understand the way that science can be helpful here. And so you have a little bit of an ecosystem developing there. And I think that the moment is right for that to happen a little bit with social policy making in the United States and in North America, where ideally what you have is you have a new playbook. When you come to a new jurisdiction, maybe as a mid-level staffer, right? I would like to see people get taught, this is how you do it. This is how you incorporate evidence into your policymaking. This is how you think about scarce resources as both a problem and an opportunity to generate new information and to be better about the way that you direct services to people. When you're working in a legislature, I'd like you to think about ways that you can facilitate the dissemination of evidence-based policymaking. So funding studies of new pilots, encouraging agencies to develop evidence and come back, scaling up evidence-informed policies. And then within the sort of general public, right, I think that it would be really helpful for there to be a growing awareness of the way that science, actual science, can be applied in social policy.
That's great. Now, one last question for you. What is your superpower?
My superpower, my goodness. Well, I think that my superpower has been, I've been really fortunate to be around some really great people. And so I think of my superpower as, my family and my community and my colleagues, where, I think that very little of what you accomplish solely on the basis of your own skills, but sort of together, you can sort of build a community around some key ideas and get some things done.
That's great. Well, Quentin, thank you very much for being with us today. Before you go, tell us how people can find you and connect with you and learn more about the work that JPAL's doing.
Sure, yeah, that would be great. So as I mentioned, I'm at QPALFREY on Twitter. You can find me on LinkedIn. We are at MIT, we're the povertyactionlab.org, and I hope that folks will reach out to us. We'd love to work with partners of all sorts.
Fantastic. Quentin, thank you very much for being with us today. We wish you every success in continuing your great work there at JPAL.
Thanks, Devin. Likewise.
All righty, let's do